Question 1. A client with heart failure presents with crackles and dyspnea. Which medication helps reduce preload? A. Digoxin. B. Furosemide. C. Metoprolol. D. Lisinopril. Answer: B. Loop diuretics reduce circulating volume, decreasing preload and pulmonary congestion. Question 2. Which ECG change is most commonly seen with hypokalemia? A. Peaked T waves. B. Prolonged PR interval. C. Flattened T waves. D. ST elevation. Answer: C. Low potassium causes flattened or inverted T waves and U waves. Question 3. An atrial fibrillation client is at highest risk for which complication? A. Heart failure. B. Myocardial infarction. C. Stroke. D. Cardiac tamponade. Answer: C. Atrial fibrillation promotes clot formation in the atria, increasing stroke risk. Question 4. Which medication is first line for chronic stable angina? A. Morphine. B. Nitroglycerin. C. Furosemide. D. Heparin. Answer: B. Nitroglycerin relieves angina by dilating coronary arteries and reducing preload. Question 5. A widened pulse pressure is most associated with which condition? A. Aortic stenosis. B. Mitral regurgitation. C. Aortic regurgitation. D. Pulmonary hypertension. Answer: C. Aortic regurgitation causes increased systolic and decreased diastolic pressure. Question 6. Which lab value is most important to monitor in a client receiving digoxin? A. Sodium. B. Potassium. C. Calcium. D. Magnesium. Answer: B. Hypokalemia increases the risk of digoxin toxicity. Question 7. Which symptom is classic for left-sided heart failure? A. Peripheral edema. B. Ascites. C. Pulmonary crackles. D. Jugular vein distension. Answer: C. Left-sided failure causes pulmonary congestion and crackles. Question 8. Which finding indicates cardiogenic shock? A. Warm skin. B. Increased urine output. C. Hypotension. D. Bradycardia. Answer: C. Cardiogenic shock results in poor cardiac output and hypotension. Question 9. The priority nursing action for acute chest pain is to A. Obtain ECG. B. Administer oxygen. C. Give morphine. D. Draw cardiac enzymes. Answer: A. Obtain ECG first, then oxygen. Question 10. Which medication reduces mortality in heart failure? A. ACE inhibitors. B. Calcium channel blockers. C. NSAIDs. D. Antiarrhythmics. Answer: A. ACE inhibitors reduce remodeling and improve survival. Question 11. ST elevation on ECG indicates A. Myocardial ischemia. B. Myocardial injury. C. Myocardial infarction. D. Ventricular hypertrophy. Answer: C. ST elevation reflects acute myocardial infarction. Question 12. Which condition causes Beck's triad? A. Heart failure. B. Cardiac tamponade. C. Pulmonary embolism. D. Aortic aneurysm. Answer: B. Beck's triad includes hypotension, JVD, and muffled heart sounds. Question 13. Which drug is contraindicated in cardiogenic shock? A. Dopamine. B. Dobutamine. C. Metoprolol. D. Norepinephrine. Answer: C. Beta blockers decrease heart rate and contractility, worsening shock. Question 14. Which valve disorder produces a holosystolic murmur? A. Mitral regurgitation, B. Aortic stenosis, C. Mitral stenosis, D. Aortic regurgitation. Answer A. Mitral regurgitation causes a blowing holosystolic murmur. Question 15. Which lab marker rises earliest after myocardial infarction? A. Troponin, B. CKMB, C. Myoglobin, D. BNP. Answer A. Troponin is the earliest and most specific marker used clinically and on NCLEX. Question 16. Which ECG rhythm requires immediate defibrillation? A. Asystole, B. Ventricular fibrillation, C. Sinus bradycardia, D. Atrial flutter. Answer B. Ventricular fibrillation is a lethal rhythm requiring defibrillation. Question 17. Which assessment finding is expected in right-sided heart failure? A. Pulmonary edema, B. Crackles, C. Ascites, D. Orthopnea. Answer C. Right-sided failure leads to systemic congestion such as ascites. Question 18. Which medication prevents platelet aggregation after MI? A. Warfarin, B. Aspirin, C. Heparin, D. Alteplase. Answer B. Aspirin inhibits platelet aggregation and reduces mortality. Question 19. A prolonged QT interval increases the risk for A. Atrial fibrillation, B. Heart block, C. Torsades de Pointes, D. Sinus tachycardia. Answer C. Prolonged QT predisposes to torsades de Pointes. Question 20. Which condition causes pulsus paradoxus? A. Heart failure, B. Cardiac tamponade, C. Myocardial infarction, D. Hypertension. Answer B. Tamponade causes exaggerated BP drop during inspiration. Question 21. Which medication is first line for acute pulmonary edema? A. Digoxin, B. Furosemide, C. Propranolol, D. Verapamil. Answer B. Diuretics reduce fluid overload in pulmonary edema. Question 22. Which finding suggests digoxin toxicity? A. Hypertension, B. Green-yellow vision, C. Weight loss, D. Dry cough. Answer B. Visual disturbances are classic signs of digoxin toxicity. Question 23. A third heart sound, S3, indicates A. Normal finding in adults, B. Ventricular volume overload, C. Valve stenosis, D. Atrial contraction. Answer B. Ventricular volume overload reflects increased ventricular filling and heart failure. Question 24. Which risk factor is non-modifiable for coronary artery disease? A. Smoking, B. Obesity, C. Hypertension, D. Age. Answer D. Age cannot be modified. Question 25. Which medication is used for rate control in atrial fibrillation? A. Atropine, B. Metoprolol, C. Epinephrine, D. Lidocaine. Answer B. Beta blockers slow ventricular rate in atrial fibrillation.